Welcome to our video on what you need to know about dental scaling and root planing. If you've been thinking about undergoing dental scaling and root planing, here are a few things to know before you go. Here we will discuss the benefits and risks of this procedure, the symptoms of gingivitis, and how you can avoid having this procedure performed. Once you've decided on a dentist, book your appointment. And, of course, you should always visit them for regular checkups, regardless of whether you have a chronic condition like periodontitis. Periodontal scaling and root planing. The procedure is an essential part of periodontal maintenance. The process of scaling and root planing will remove plaque and tartar from your teeth and gums. Plaque forms on your teeth and provides the right conditions for bacteria to grow, irritate your gums, and contribute to gum disease. Fortunately, regular dental checkups can prevent the development of gingivitis. If you experience any of these symptoms, you may need to see a dentist for periodontal cleaning. You may notice some swelling and sensitivity for a few days after scaling and root planing, but the procedure is not painful and can be completed in a single visit. In addition to the cleaning, your dentist will likely use an antiseptic mouth rinse to reduce any pain. If soreness persists, you may want to take over-the-counter pain relievers or consider taking a painkiller. In most cases, minor bleeding will stop within a week. During scaling and root planing, your dentist will remove plaque and tartar from beneath your gum tissue, and then smooth the surface of the tooth roots. This procedure is often done using a metal dental instrument, ultrasound energy, or lasers. During the process, your dentist will first break up plaque on your teeth and gums, so that you can eat or drink without fear of pain. Once the plaque has been removed, he or she will apply an antibiotic to the pocket. Periodontal scaling and root planing are excellent options for improving your gum health. The treatment may be necessary if the disease is not properly treated. Without proper care, scaling and root planing may cause the gums to swell and cause pockets to form. A pocket formed underneath the gums is the first sign of periodontal disease. Infection of the gums can lead to tooth loss and a poor healing process. After the procedure, you will need to return to your dentist for periodic cleanings. The dentist will likely recommend a 90-day interval between visits, although this is arbitrary. Usually, patients who have deep pockets will need additional visits. This will give them the opportunity to heal, and your dentist will have the necessary tools to keep the disease under control. In addition to regular cleanings, you should also brush and floss your teeth and use a mouth rinse to combat bacteria. Pain associated with the procedure. Though the procedure itself is relatively painless, patients may feel discomfort after the procedure. While a local anesthetic can be given to numb the gums and tooth roots, this is not always sufficient. The dentist will use specialized tools to remove plaque buildup, which makes the process less invasive. After the procedure, a saltwater rinse will be suggested for a few days to reduce any discomfort. In addition, patients should refrain from smoking for a week or so to reduce the pain associated with dental scaling. Gum disease can be caused by bacteria-filled plaque that accumulates along the gum line. People who smoke have an increased risk of developing this condition, so visiting the dentist at least twice a year is highly recommended. Dental scaling involves cleaning areas beneath the gum line, which is done without surgery. Patients with receding gums may require deeper scaling. The dentist may have to reach the roots of the teeth to remove plaque and bacteria. The procedure is also known as root detoxification. The goal is to remove plaque and tartar from the tooth root, which is responsible for the appearance of stains on your teeth. Scaling and root planing are two common dental procedures used to treat periodontitis. Deep cleaning is one of the most effective ways to prevent tooth loss and damage. Scaling removes the tartar that accumulates on the surface of the teeth, while root planing smooths out the roots and helps the gums reattach to the teeth. Deep dental cleaning in Winnipeg is an excellent way to treat periodontitis. After the cleaning, patients may experience pain and sensitivity. Additionally, they may experience swollen and tender gums. A dentist may also insert an antibiotic called subantimicrobial dose doxycycline in the gum pocket to reduce the risk of infection. This medication can be taken for a few days afterward to prevent a possible infection. Symptoms of gingivitis. Symptoms of gingivitis after a dental scale and polish are a sign that you might have gum disease. Symptoms can range from bad breath after brushing to tenderness when chewing. X-rays are required to determine whether your condition has spread to the bone. If you notice any of these symptoms, your dentist will likely refer you to a periodontist. Here are some common symptoms of gingivitis and how to tell if you have the condition. Your doctor may recommend that you see a periodontist if you suffer from periodontitis or other gum diseases. While gingivitis is treatable with a dental cleaning, it may recur after a dental scale and polish. If this occurs, the disease will likely progress to periodontitis, which damages the structures that anchor your teeth. To avoid the recurrence of gum disease, you need to practice good oral hygiene habits and cut down on smoking or diabetes. Your doctor can also recommend treatments for gum disease, including root planing, which smooths out rough areas on the root surface and removes tartar. Aside from dental scaling and polishing, you may also experience inflammation of the gums. You may notice puffy, red, bleeding gums. Your gums may also be slightly tender. If you are experiencing this, you will want to refrain from chewing on a hard object for a few days. Afterward, you can resume brushing and flossing as normal. If your gums are tender, you should take antibiotics as directed. While this treatment may cause some discomfort, it can also make your gums healthier. This process removes plaque and tartar from the root of the teeth. It is more aggressive than your average cleaning. It can take several visits to thoroughly clean your mouth. You may need a local anesthetic before your appointment. You should continue your oral hygiene routine at home, including brushing and flossing regularly. Your dentist will prescribe mouthwash as well. The most important part of dental cleaning is the preparation for the procedure. Scaling and root planing remove plaque and tartar from below the gum line. Then, root planing smooths out irregularities in the root surface so that the gums fit tightly around the roots of the teeth. In most cases, scaling and root planing is enough to reverse gingivitis, but more advanced cases may require multiple appointments and even antibiotics. Prevention of gum disease. In a recent Cochrane review, prevention of periodontal disease with dental scaling and polishing was shown to be more effective than routine cleaning alone. The results of this study are discussed below. One study examined the effectiveness of 2 dental professionals in removing supragingival calculus. Participants in the study were matched based on their age and full mouth plaque scores. The mean probing depth was also compared. Another benefit of scaling and root planing is that it teaches proper brushing techniques. While brushing with a conventional toothbrush is helpful, many people don't realize that flossing is vital to keeping your gums healthy. Brushing with the proper technique, using fluoride toothpaste, and flossing regularly will help you prevent gingivitis. Scaling and root planing are 2 procedures performed by your dentist to remove tartar and plaque from teeth. While scaling and root planing are effective, they are not a substitute for home plaque control. Typically, scaling is provided as part of a dental recall visit. The dentist will remove the buildup of plaque, a mineralized deposit, and debris from the teeth using specially designed dental instruments. There are ultrasonic scalers available for this purpose. These procedures are a good option for the prevention of periodontal disease and its treatment. A more advanced form of periodontitis involves the destruction of the bone that holds the teeth in place. In this stage, patients often have to undergo several dental appointments in order to see improvement. Eventually, the disease may progress to periodontitis, resulting in tooth loss and the need for a dental implant. In this case, the treatment includes periodontal scaling and root planing, which may take more than 1 visit. To minimize any discomfort, a local anesthetic is applied to the teeth and gums. While prevention of periodontal diseases with dental scaling and polishing is beneficial, the effectiveness of these treatments remains controversial. A recent Cochrane review compared the effects of 6 monthly scaling and polishing on gingival calculus levels. The results revealed a significant reduction in the number of patients with chronic periodontitis compared to those who received only 1 treatment. But despite these benefits, these studies are inconclusive. Thanks for watching. Please like, comment, and subscribe for more.